At some point, a patient became a customer, and then a patient
Mhm.
survey became something that determines compensation, insurance compensation
Yeah.
based on a survey. But we talk to patients all the time. It's a collaborative experience. And so patient care should be as much about taking care of the provider, the healthcare provider, as much as the
Yes.
patient. Because when I'm
Yeah.
comfortable, when I'm happy, when I'm satisfied, I'm a much better nurse.
Yeah.
It's just a fact. And it doesn't affect
Because
the
how
hospital's
can
bottom
we
line because you're producing better healthcare providers and you're gonna get better surveys in the end. But to be
Yeah.
so lopsided one way, I remember I was hired at a place, right? I was experienced, but I still for a couple of weeks had to work with a nurse, another nurse, just so I can understand that hospital. So I'm working in the ER. We have about 8 patients at this hospital. That's the max. But there's 2 of us. And I got to say, the patient turnover was just incredible. To hospitals, in this case, hire more nurses so that maybe instead of 8 patients per nurse, you have 3 or 4, which I think they're doing in California. You might be hiring more nurses, but you're making more money because where the turnover is twice, is
Yeah.
50% more, and the patient
'Cause it can
satisfaction.
accomplish so much more when you only have 4 instead of 8, and you can get them discharged faster, and you can complete their CAT scan that they're waiting on. It's not so
I was doing things I
How
never sorry to cut you off, there was a delay, I'm sorry
No,
about that,
that's okay.
Tammy, but there was,
No, it's
I
okay.
was doing things I never would have thought, "Oh, you know what? I'm just gonna put in a better IV because I got some time," or, "You know what? Oh, let me see, where is
Oh,
that tray? He wanted that. Let me go see if we have that." I have no time for that on a normal New York floor of 8 to 12 people, but that's a better nurse right there. That was a better patient experience right there. You'd make it back so much more if you just put the human element first. You're hiring more people, but you'd make more money. And it's a shame that you have to pitch it to hospitals. You'll make more money. Not that you have, yeah, I don't know. I'm babbling,
well,
but
no, it's so true, and don't you feel so much better about your career, about your profession when you give good care? Therefore, morale is higher. Therefore, you're just a better employee in general. You're not as burned out when you can do that, and I don't understand why hospital leadership does not understand that. How do they expect us to feel safe saving people's lives when we are always looking over our shoulder? How can we save lives when we fear for our own?
certainly I've been attacked. And a lot of times on units, the male nurse is, I won't say expected, but there's definitely a lot of collective hope that I'll show up to something. But I feel like female nurses really have to go through it. I've taken over patients that I know were a nightmare to the female nurse, and I get in there. That's not going to fly, buddy.